syncope is a very rare condition which is characterized by a patient losing consciousness with a coughing fit. And part of the mechanism behind cough syncope is that with a cough, there's an acute increase in the intrathoracic pressure within the lungs, and of course within the chest cavity there is a finite amount of space shared between the lungs and the heart, and the increase in size of the lungs and the increase in pressure in the lungs actively impedes the return of blood through the inferior and superior vena cava back into the heart, causing an empty heart. So an empty heart cannot generate a very good blood pressure, and therefore the patient faints. Now, treatment for cough syncope in any situation really should be directed at treatment of the cough, because if you get rid of the situation, as with any situational syncope, you will get rid of syncope. So the most common cause of coughing in this patient cohort would be coughing related to an intrinsic problems with the lungs. So whether it's asthma, which is undiagnosed, chronic obstructive airways problems, or problems sometimes with swallowing. So some patients have an oropharyngeal weakness, for example after a stroke, or an intrinsic weakness and an inability to swallow safely. And so the food goes down the windpipe rather than esophagus, and that triggers a coughing reflex. The other aspect of coughing that we often investigate for is gastroesophageal reflux, and that's also another very treatable cause of coughing that can lead to syncope.